Salam, Dr. Pulp. I was told by the receptionist to see you.
Hello, Ridge. Yes. I asked her to call the patient's attendant. Please take a seat.
Is my mother fine now? How did the surgery go?
Yes. Your mother is fine, but you will be driving her home. We have successfully removed your mother's wisdom tooth.
Great. Hope she feels better soon.
Definitely. This is why I called you. To verbally give you instructions. So that your mother can have a speedy recovery.
I am listening, Dr. Pulp.
Mrs. D'Souza, please bite firmly on the gauze for at least 30 minutes and do not chew on the gauze. It is normal for a fresh extraction site to ooze slightly for up to 24 hours after the extraction procedure. However, I have provided you a second pack of gauze to bite on for 1 hour in case the bleeding does not stop. Avoid talking for at least an hour. Also refrain from licking or touching the socket area. Tobacco and nicotine interferes with wound healing. So you are advised to limit smoking for at least next 4 to 5 days. Also make sure she drinks plenty of fluids today throughout the whole day. Like chilled shakes, water, fruit juices and iced teas are favorably recommended. But make sure she drinks them in a glass. The straws are to be avoided. Because sucking fluids with a straw creates a negative intraoral pressure. Similarly, spitting also creates a negative pressure which then triggers fresh bleeding. So it is advised not to spit during the first 12 hours after surgery. Swallow the saliva instead of spitting it out. Strenuous exercise is to be avoided for few days, especially during the first 24 hours after the surgery. Heavy workouts will result in increased blood pressure that may result in greater bleeding.
I understand completely. Do I have to buy any medicines?
For pain, she can take either ibuprofen 400 mg or Panadol 500 mg. It is prescribed that you give her the first dose before the effect of anesthesia wears off. Then give the subsequent doses after every 4 hours. Furthermore, eat a soft and cold diet for the first 24 hours. Avoid spicy foods and try to chew from the other side. Try eating an ice cream. It will give a soothing effect. After 24 hours, she should begin gentle rinses with warm dilute salt water 3 to 4 times a day for approximately 1 week. You may also add mouthwash for flavor. Avoid brushing the teeth immediately adjacent to the extraction site initially. However, resume oral hygiene measures by 3rd or 4th day. Please know that keeping mouth clean results in a more reliable healing.
All right, Mother, let's take you home.
Miss Pulp has been very kind.
Should we expect any complication, Dr. Pulp?
Most probably not. However, if any emergency arises, you can contact me on my number. However, do keep in mind that a moderate amount of swelling is expected. It is nothing to worry about as it is a healthy reaction of the tissue to the trauma of the surgery. It will resolve within a few days. Swelling may wax and wane, occurring more in the morning and less in the evening because of postural variation. Sleeping in a more upright position by using extra pillows will help reduce facial edema. To minimize post-operative swelling, it is suggested that on the first day right after extraction, you place an ice pack or small bag of frozen pea on the local area for 20 minutes at different intervals. On second day, neither cold pack or heat pack should be applied to the face. And then from the 3rd day onwards, the application of heat will quickly resolve the swelling. You can apply heat on the face through heat pads or hot water bottle. Also, do not be alarmed by trismus or ecchymosis, as both of them can be expected as well. Trismus, that is limitation in mouth opening, will likely resolve within a week. Similarly, after 2 or 3 days, if a bruising appears on the cheek, submandibular area or anterior neck, do not become apprehensive as it will also resolve fully within 1 week. I will be removing the stitches next week once the wound has healed properly.
Thank you.